One of the key elements is a medical record that's centralized, that we all begin to share. And this is your electronic health record. And this has been costly to most of us, because in a solo practice in the office, we can't connect as easily. We do this in our scribbling, writing, and keep this in our medical record. But the medical record basically is a medical home. We're also looking at quality. And quality of care is defined as outcomes, evidence-based. We have to do a double standard on everything. When you have a new drug out, you give standard placebos plus the drug to see whether that disease has improved. Because obviously in this prospective evaluation, you have to see, is a drug that effective, and what are the side effects or complications. And if you give some placebos or really non-medication, and it does the same thing, then you know quality is not with that one drug. Programs have to be viewed this way as we begin to develop community health centers, quality care. It's again evidence-based cost effectiveness that has to be done as we do early interventions. Being close to home was an accessibility geographically and financially for the families to see a family physician. Secondly, we looked at family partnership as an important measure of family-centered care. And with this, we looked in terms of coordinated care using the community resources as a factor of importance in pulling together what is existing in family support, parent education, and support for the child and infant as it grew. So continuity became an important factor. But here in Hawaii, we knew that culturally effective care was critical in our minority group where everyone is part of the majority. We're looking at different races, the Native Hawaiians, Polynesians, Pacific Islanders, the Caucasians, and how we blended their cultural background in being disease-oriented to prevention and early intervention. Finally, we looked at training for doctors with compassion, because this is so essential in anyone dealing with children and families. So essentially, we looked in terms of accessibility, family-centered care, coordinated care, comprehensive, continuous, culturally effective, and compassionate primary care.
Community health centers take into account what's important to the patients, the community, and is more than medical care. When I come here for care, I'm not a number, I'm not an appointment, I'm a person. My providers listen to me, they help with my assessments, they provide me educational tools, they provide me hope and inspiration to make healthier choices. And for me, it includes my spiritual care, the care of the community that I am so committed to seeing healthier.
A medical home in this community is very important. It creates sustainability for our community members. It also creates self-sufficiency for our families that live on this coast. Without a medical home, we were probably looking at 525 families being unemployed here in our community. So a medical home is very important to us.
Being a part of the center has truly encompassed the whole vision of what a medical home should be, from my children all the way up to the older generation. It encompasses all the medical needs, from enabling services to medical necessities, internal medicine, family medicine. It incorporates community medicine into the health center realm. This is one place that I know that I can come to and be taken care of. All of my needs are taken care of. My social needs, my medical needs are all taken care of in one place.
Community Health Center services over 25,000 people, many of them with special needs and low income. We have adopted an electronic medical record, which we use to capture, which we've been using for over 5 years now. We use it to capture more than just medical information. We've actually developed a case management template in which we can capture things such as interpretive services, health education, group education, etc. Things that we need to capture for grants and stuff like that.
We truly provide comprehensive services to all of our patients. And it not only includes those types of traditional reimbursable services, but what we found real value in are those types of services, supportive services, that are not considered reimbursable. Those kinds of services we feel really contribute or are key components to making sure that we provide the kind of quality of care to our patients that our mission has us doing.
They know us here. They understand my son's special needs. The staff here are like my friends and neighbors. We can relate to.
To me, to them, they're up and up. See, that's one thing. They don't give me the runaround. This is what they tell me. It's up to you, because after all, you come here for my help. For they want. I'm there for them to help me. Now, if I'm just going there, they do get doctors. They're just telling you, and you're just wasting my time. I look at them. I tell myself, true. I'm just wasting your time. You're just going up there, yak and there. So sometimes I know I have to help myself. But that's what I see in doctors up there. They do care about the patients. They do. But sometimes they leave them up to the patients. And I think I'm one of them.